to take your question today. So in the last video I talked about how a patient that came in from out of state had a device made that was super difficult to clean, which made her tissue get inflamed because food was getting caught in there all the time, and this led to bone loss and ultimate implant failure, which is why she was seeing me. Your question was this: you're getting your device made here soon by a prominent periodontist, and you didn't want to have the same thing happen. And what advice would you give to you to tell him? So here is my advice. Number one, be super clear to him that your number one priority is that you want the device to be hygienic, that you want it to make sure that it's easy to clean. Why? Because it'll make the dentist work harder. There is still a standard of care that has to be met, and especially if he's like me, which I'm sure most dentists are, is they are perfectionists and they want to make patients happy. They want to have a great smile. And so if you tell them that your number one priority is hygiene, and then that you still really want a really nice smile, then that requirement will be met. It's when a dentist that's well-intentioned tries to make the patient happy, sometimes in chasing his tail or trying to please the patient so much, it's oftentimes he forgets his true north, right? It's kind of like his compass. And then it's easy to start to rationalize, well, I think that they'll be okay, and I'll just make sure that they know that they have to clean really well. And here's my other thought with that is, even though you might be super motivated right now, life happens. I don't know if you've experienced this, but you go through a 2020 COVID year, and you go through some depression or some really tough times, a loss, a death in the family. Things like this can put you into a place where you're not as diligent in cleaning and hygiene. I've had patients where they've had heart attacks or strokes, and literally their dexterity has gone, so now they can't. Now they're dependent on someone else to clean their device. So always make sure that you just be clear with your periodontist. And of all the dentists that make devices, I would hope that a periodontist would be the most vigilant in doing this, because that's kind of their area of expertise, is keeping the gums healthy. But if you look at that last slide, that last picture on my last video, those are kind of the requirements or the guidelines to making a really hygienic device. There's like 4 or 5 items there. Bring those to him and say, hey, can we just go through this as a checklist? I know that you're great and do what I know you're good at what you do, but would you be kind enough to show me the bridge out of the mouth? And can we walk through these things? I really, this dentist that I trust said these are some things that I could look at, and so if you took that approach and did it in a really humble way, because as doctors, I think sometimes we can get a little bit we're just sensitive people, and we don't like we want people to trust us. And so let them know, like, I trust you 100%. That said, I would just love it if you could explain this to me, help him teach you, so will you teach me what he's talking about here, and let the doctor teach. Sometimes doctors love that too. So I tell my patients that, trying to catch bees with honey is always easier. When people are nice and kind, I'll do anything for them. And then sometimes when they catch me on a bad day and they're being really mean or rude to my staff, then maybe you're not going to get what you want, because it's this human nature that we resist or we oppose things that push us too hard. So be super kind, gentle. Let him know that you have all the confidence in him, but you just wanted to kind of document. Maybe you say, hey, can I take some pictures? I want to document my story. And it gives you an opportunity to sit and look at him when he's not around. And definitely do a try-in. Now, this is the other suggestion I want to give to you is, most of the time you have temps, and then you will go into one try-in. You'll do a try-in. It means that you actually put something in your mouth that resembles what is going to be the final. And that's when you have a chance to look at it out of the mouth, but more importantly, you have a chance to see how it feels in the mouth. That's where you'd see if it meets your cosmetic concerns. That's where you have a chance to kind of see how you speak with it. Although oftentimes, because you had something in your mouth for so long, it's difficult to just stick something in your mouth and speak easily. So I wouldn't put the speech like that being something you're going to be able to resolve in that appointment. But usually the final device is going to be a lot more comfortable. You're going to be able to have a lot more room. Basically, the whole point of doing a try-in is to be able to visualize, feel, and see all the changes that you wanted to make from your temporaries to your finals. And in my office, usually this means that they're going to have a device that's a lot thinner, that now we've gotten past that phase of temporaries. Now I feel like I can make it to the final calculations, because that's what's going to be in zirconia. So this is just impromptu. Hopefully I didn't ramble on too much here, but I really appreciate you asking me the question. Thank you for your confidence in me. I'll send a link at the bottom of this. If this helped you out at all, do a review for me. That'd be great. I'll send us a link, and if you can, it'd mean a lot to me just to tell me how I'm doing. Give me feedback too. I'm just so busy, but this YouTube page is really important to me. I want to make sure that I'm continuing to take care of the people that say so many kind words about me. So sure appreciate you. Good luck. And if you have any other questions, reach out back out to us, and we'll take good care of you. Thank you. I'll see you.